So the first few questions should be pretty straightforward because it's things that I told you right in your notes. Who can tell me what an antigen is? How about Jacob Johnson, you tell me what an antigen is. It's the protein on the red blood cell surface. So it's the one that is on the red blood cell. Who could tell me what an antibody is? Why doesn't Easton tell me what an antibody is? It is a protein in the plasma that attaches, well, that was bad writing, to foreign cells. So they are both proteins. That's something they have in common, but where they are in your blood is very different. What happens in agglutination and why can it be deadly? Would anyone like to tell me what that is? Fancy science word? Yes. All right, so first of all, you are right. Your blood clots because of foreign cells, and specifically, it's because of those antibodies. Antibodies attach to foreign cells and start making clumps or clots. And why can it be deadly? Just as John said, we could have a heart attack or a stroke, like we saw in previous lessons, because of things clotting. Does anyone have questions that they would like to ask about those first three sort of basic definitions? So then the next few questions are all, what would happen if? So in number 4, the patient has AB positive blood and they are receiving B positive blood. What is going to happen? So let's start with, is this okay? Is this match going to work? Yes, no. Yes. So, this will be a match. Why will it be a match? Well, I'm just going to illustrate what both people have. The patient with AB positive blood has on their red blood cells A antigens, B antigens, and the rhesus factor, so the Rh antigens. That's what the positive stands for. That means that in their plasma, they don't have any of those antibodies. If they did, they would be attacking their own blood. So, because there are no antibodies, this type of blood, AB, specifically AB positive, can receive any other type of blood. Type B, of course, has B antigens and Rh antigens. When I put this into blood that has no antibodies, no reaction will happen. And we are always concerned with the antibodies of the receiver, not of the donor. Now the next question, someone with type B positive receives A negative or AB negative blood. Is this okay? Yes or no? I heard a no. The answer will be explained the same way. Here's my person with B positive blood. They have B antigens and Rh antigens, and then they have A antibodies, because they don't have the A antigen. On AB blood, I have A and B antigens. Since it's negative, that's all I have. Since the person with B positive blood had that antibody, they are going to attack AB blood. So this is not a match. Agglutination would occur. The person could potentially die. 6 is asking about someone with O negative blood receiving A negative blood. Is this a match? I saw someone shake their head. I'm going to take that as a response for no. Here's my type O patient. That's their red blood cell. There's no A antigen, there's no B antigen, and since they're type negative, there's no Rh antigen either. That means that they have the A antibody, the B antibody, and the Rh antibody. Their blood will attack any of those antigens. So when my donor, who has type A negative blood, which would be like that, is mixed, this antibody is going to agglutinate with those red blood cells. So it is not a match. Does anyone have any questions they want to ask about 4 or 5 or 6? So 7 is fairly similar, except that I'm asking you which types of blood could I give this person. So they have A positive blood. If you have A positive blood, that means you have A antigens, you have Rh antigens, but you don't have any B antigens. So you have B antibodies. So that means this person cannot receive blood that has the B antigen, but they could receive another kind that doesn't. So hopefully you put they could receive A positive blood. You can always receive the exact same type of blood as you have. They could also receive A negative. They don't have the antibody for the Rh factor, so it doesn't matter whether the blood has it or doesn't. They could also receive O positive or O negative. Those are all of the blood types that don't have the B antigen in it. All of the other types, AB positive, AB negative, B positive, B negative, would all react with this B antibody. Does anyone have questions there? So flip the page over. We got the last few questions. The first ones are the true or false. Now, number 1, let's say it's partially true. Type O is a universal donor, but if we wanted to be the most specific, we would say O negative. So I'm going to say that was false because it wasn't completely the truth. O positive is definitely not a universal donor. O negative is. Number 2 is true. We saw that on the definitions on the other side. Number 3 is false. There's 2 ways we could correct it. If you have no antigens attached to the membrane of your red blood cells, that means that you are type O negative. I could also change the sentence by saying an individual who has A and B antigens is type AB. So there were 2 ways you could change the sentence. Either you could say what AB actually is, or you could say which blood type has no antigens. And number 4 obviously can't be true because we just said O negative was the universal donor. Type AB is the universal recipient, assuming that it is AB positive. And so that's how we should correct the ones that were false. Now the last 2 are multiple choice questions. The first one asks which one would be beneficial for the recipient. In other words, which one actually works. So can a type A person receive a transfusion from a type B person? No. Can type B receive from type A? No. Can type A receive from type O? And there it is. Anybody can receive type O blood, so C is the best answer. Now the last question is asking about antibodies for 2 different patients. Patient 1 has AB positive blood, and patient 2 has A negative blood. But I'm not looking for the antigens they have, I'm looking for the antibodies. So if I draw AB positive blood, when you have AB positive blood, you have all of the antigens and none of the antibodies. When you have type A negative blood, you have A antigens, then you have the B and the rhesus factor antibodies because you don't have those antigens. So patient 2 has B and rhesus, not A. Patient 1 has none. So that means that B has to be our answer. So we are on the last section of this chapter on circulation. It's about immunity. Now, I mentioned yesterday, even though I said I was talking about blood yesterday and immunity today, these two sections are really kind of mixed together, and that's still the truth. We're going to focus on the part of your blood that has the most impact on immunity. Red blood cells play a role in this because we saw antibodies will attack the antigens on your red blood cells. But it was the antibodies in the plasma of your blood, not antibodies on your red blood cells. Today we're going to talk mostly about white blood cells and about how your body defends itself against infection, against foreign particles. So this is the last section. The first thing that we'll talk about are some reasons that you would get an infection. And the main number one reason that you would get an infection is something called a pathogen. Now, to describe what a pathogen is, I thought it would be best to give some examples. A pathogen is any foreign cell or foreign substance that is going to bring an infection into your body. So your body would need to respond and attack it. Now, in these examples here, I'm giving you some illustrations of types of pathogens. I'm not going to ask you to know the details of all of these pathogens. It's just so that you have some sort of frame of reference. You'll also notice I even decided to spell this word like it was in French. This will be the word attack. So pathogens. Pathogens are things that are causing infections. They could be a virus. Now you'll notice that when I said what a pathogen is, I said it's a cell or a foreign thing, and that's because viruses are not considered to be living cells. They need a host to survive. So a virus, like chickenpox, like HIV, like the influenza virus, could be something that causes an infection. We're going to talk about these T cells in a little bit. So I just wanted to mention, when someone has HIV, it's the human immunodeficiency virus. Some of the cells that their body normally uses to fight infections are being attacked. And so that's why their ability to fight off infection is reduced. It could be a bacteria. That's what causes tuberculosis or cholera. It could be a fungi, like what causes athlete's foot. It could be a protozoan. That's a small unicellular organism. That's what causes malaria, for example. It could be some kind of worm, which sounds super gross, but it's a way that infections are transmitted. There's a worm that causes snail fever, which is called bilharzia. I just thought that was a cool word. There are roundworms, so there's more than one kind of worm that could be giving you an infection. Just for illustrated purposes, I put a picture down here of this one, elephantiasis, which is when your skin and lymph, which is another type of fluid that's running through your body, are having some issues, and a lot of that fluid collects in the lower limbs, and so it looks like it's bulging out, kind of big like an elephant. That's where the name is coming from. Now, how do you get an infection? These are things that you should be able to give an example of. So, you could get an infection through the air. That's because bacteria, in particular, viruses, can be transmitted through the air. You could get an infection through water, by drinking in it, by bathing in it. Water could be a reason. You could, of course, get an infection from your food if it's not preserved or cooked properly. Bacteria are really likely. Worms can also develop in food if they're not preserved properly. Insects are a big one. You might be aware that mosquitoes can carry malaria, and so that would be a way that you could acquire that. Of course, sexual transmission, like you've probably heard in every religion sex ed class that you've had since the beginning of time. And then some conditions, but not all, could be because of direct contact, like you're touching another person, not you're kissing them or anything like that, just actual contact. That would be the case, for example, for chicken pox. You can get that just by being near someone who has it. So you should be able to give an example of how an infection could be transmitted. Would anyone like to ask any questions about how you get an infection or how it's transmitted? All right. So, how does your body defend against infections? Well, before we even get to your blood, which is the main focus here, you have your skin and all of the membranes that surround your tissues. They are acting as physical barriers, trying to stop these pathogens from getting into your system. In association with your skin and the membranes at the exterior of your body, you have things like mucus, like what's in your nose, acidity, so there's acidity in your stomach, for example, tears, like what you have in your eyes, and of course, blood clots. Now, blood clots, because they are directly involved with your blood, is the one that I'd like to expand on a little bit. You have in your blood things called platelets. Their sciencey name is thrombocytes. CYTE means cell, like we saw yesterday. A red blood cell is an erythrocyte. Thrombo means clot. So a thrombocyte is a cell that's making a clot. They, just like red blood cells, are produced in your bone marrow. And rather than being a full cell, they are fragments. And they have proteins in them. I named them just for informational purposes. I'm not going to ask you to be really specific there. But they have proteins in them that cause your blood to clot. So they are small fragments of cells that are produced in the bone marrow. Platelets are part of that 1% of cells. So if I look at my test tube full of stuff, in this 1% are platelets and white blood cells. So we can get an infection, but our body will try to prevent it. First, because of your skin, and in conjunction with your skin and membranes, blood clots. Since it has to do with blood specifically, make sure that you know the word thrombocyte. I would definitely use it. And recognize that it's produced in the bone marrow, just like red blood cells. Platelets, because they are fragments, are very, very small. So if I were to compare them to a red blood cell, they're teeny tiny. They're just a tiny little piece, tiny little fragment of a cell. Does anyone have questions that they'd like to ask about platelets, perhaps, or anything to do with skin and membranes? Maybe I'll just mention before I go ahead, tears are actually a good thing. Some of you might notice that your eyes water up when you are, say, cutting an onion, and it's your eye trying to protect itself. It's your eye trying to put a barrier between itself and the acidity of the onion. Yeah. That would be more to do with pressure changes. So because in your head, it's basically one big cavity, and when you yawn, what you're really doing, usually, is changing the pressure from the tube that goes down from your ear, down your throat, and it's connected to the inside of your head there. When you change pressure, sometimes that pushes fluid around. So, we need to talk about white blood cells. White blood cells are called leukocytes. Perhaps you've heard the word leukemia, and you know that it's bad. Well, now you know what it's about. Leukemia is when you basically have cancer of your white blood cells. So leuko means the white blood cell, CYT means cell. They, just like the other blood cells, are produced in bone marrow. So all three types that we saw, all produced in the same place. They can leave blood vessels. That's different. Red blood cells are not supposed to leave, but white blood cells can leave the blood vessels through the capillary walls. And so you might ask yourself, where are they going when they leave? And I'll mention that on one of the future slides. But where are they going? They are going in your lymph, or very specifically toward your lymph nodes. You might know that when you're sick, your lymph nodes are swollen, but you never really knew what they were for or what they were about. Now, white blood cells have a nucleus. That's different. Red blood cells did not have a nucleus. Red blood cells had a pretty specific lifespan. 4 months, that's it, they're done. But white blood cells have a very variable lifespan. It all depends what kind of pathogens they are exposed to. Now here, I'm giving you a number, not because I want you to memorize it, but because I want you to recognize there are way more red blood cells than white. So think back to that test tube, tiny little layer of white, big, huge layer of red blood cells. If you have a high white blood cell count, and we would have mentioned this in the unit on excretion when we talked about things that could be found in someone's urine that indicate a problem. High white blood cell count usually means that you're fighting off an infection. And so that you know, pus, like what comes out when you pop a zit, is actually destroyed white blood cells mixed with some bacteria and some fluid from in between your cells. But the white goo that comes out is broken down white blood cells. So your white blood cells have two effects on immunity. One of them is the direct effect. White blood cells can perform phagocytosis, which you might recall. If you don't, I will remind you. Let's call this a pathogen. And let's call this a white blood cell. You know from Science 10 that one cell can engulf another. I represent it here like a Pac-Man going to eat another cell, but that's the idea. White blood cells can engulf pathogens and destroy them that way. This, however, is pretty non-specific. That's just your white blood cell going out and eating anything that it wants to. So to make the effect of your white blood cells a little more targeted, a little more specific, your white blood cells are the reason that you get antibodies. That's where antibodies come from. White blood cells are producing them. In addition, while this is happening, while your white blood cells are trying to do their job, they are also releasing histamines. Now there's a particular type of white blood cell, it's called a basophil. We're not going to be specific about every single type of white blood cell that exists. But histamines are also released by your white blood cells. They cause dilation and permeability of capillaries. That's useful. That means that those white blood cells that left, they went into your lymph nodes to hang out, to wait, they can easily get back into your bloodstream and attack whatever it is that's causing the immune response. So we have what white blood cells are and the two basic things that happen when they detect infection. So I'm just going to pause here. All right. Someone asked me, and I'll just repeat, you don't need to draw this diagram. I just like to situate us for the next little bit of our discussion. White blood cells have a whole bunch of different categories, and we are going to focus on just one of them. So if you look here, you'll see there are lymphocytes and monocytes and basophils and neutrophils. There are several different types of white blood cells. Our focus is going to be on this category that makes up 20 to 25% of your white blood cells because they have a pretty specific role in cellular immunity, and that's the focus of our discussion. So we're going to talk most specifically just about these lymphocytes, but recognize this is not the only kind of white blood cell that exists. So we are focused on lymphocytes. So what does that mean? Cells that are in your lymph. Now, lymph is fluid that is running through your body in other vessels. So you have blood vessels that carry your blood, and then you have lymphatic vessels that carry lymph. And then you probably recognize the idea of lymph nodes. And I'll show you a slide afterwards that will situate some of these things. But there are 5 types of lymphocytes. So rather than repeat the word lymphocyte every time, I put what was different. So I have B lymphocytes, helper T lymphocytes, killer T lymphocytes, suppressor T lymphocytes, and memory T lymphocytes. All of these are called lymphocytes. Now, B cells are the ones that make antibodies. So antibodies come from the B cell. So we already know what antibodies are. Antibodies, remember, are the proteins in the plasma that attach to foreign cells. So we already saw that when we discussed red blood cells and antigens. So we have one that's called a B cell, and then we have a bunch of things that are all called T cells. Helper T cells do exactly what their name suggests. They help B cells, and they help killer T cells. So they assist those two cells in performing their function. A killer T cell is the one, like its name suggests, that actually kills the target pathogen. The suppressor T cell is the one that stops the immune response. And you might think, why would I want that? But this is actually really important. If your body kept responding as though there were a pathogen and it was gone, you would be expending incredible energy doing that for no real purpose. The memory T cell is like a clone. The memory T cell is how your body makes sure that it is prepared should it ever get the same pathogen again. And the key word here is the same. So in my examples of pathogens, one of them was the one that causes chickenpox. Once you have had chickenpox, you don't get chickenpox again. That's because your body has these memory T cells. You get it once, but then your body remembers. And so when that same pathogen comes back again, you don't have an immune response. You instead are ready right away. Your body kills it as soon as it comes in because it remembers, that was a pathogen, I had to kill it. So it's like this is little antibodies that are lying in wait, just ready, just in case that same one comes back. Now, highlighting the word same, then you might ask, why do I get a cold every year? And that's because there are more than one strain of cold and flu viruses floating around. You should not get the same cold twice, but you could get a different cold than the one you had before. And that's the problem, is there are so many strains of it that it keeps on coming back because your body doesn't recognize that it's the same pathogen because it's a slightly different variation of what you had before. So, if I were to make an analogy of this, a really common analogy is to talk about an army. When I was a kid, I had this book. It was about Louis Pasteur and all the things that he did. And in the book, they represented a vaccination as a little army of soldiers that had guns, and they were going in and they were fighting a different colored army of pathogens. And it was kind of funny and cute, but it's a really good analogy for what's happening. We would call the killer T cells, let's say, the snipers, the ones who are accurately killing the enemy. The B cells would be the ammunition supplier, whoever is making the ammunition and providing it to the army, that would be like the B cells. The helper T cells, and now depending on what branch of the armed forces we're in, would be like the guy who's next to the lieutenant with his little phone on the battlefield, taking orders and organizing everything else. It's often the sergeant. It doesn't have to be sergeant, but what I mean is it's like the assistant. It's not the main guy, it's the assistant, running around helping, making sure everybody else is doing their job. The suppressor T cell is the person who waves the flag, specifically the white flag. So we're done, war is over, battle is finished, white flag means it's over, we're done fighting. And the memory T cell, this would be, let's call them the spies that you leave behind after you say that you're done with the war, just in case the enemy starts rising up again. We could also call these perhaps peacekeepers if you wanted to be more Canadian about it. I don't know if we have spies. Doesn't sound like something we would do in our country, but who knows? So that's just an analogy to help you remember what each type of cell is doing. So this is the major function of your white blood cells that I care that you know for this course and this chapter. Is it the only white blood cell in the universe? Nope, but it's the one that we're focusing on. Would anyone like to ask questions about one or more lymphocyte? So then just on this topic of lymph, I'd like to make sure you understand what we're saying when we say lymph. So your lymphatic system is a system to accessory vessels, not blood vessels, but other vessels that carry just fluid. They empty into the superior vena cava. Oh, if you had printed out the notes, this was at the beginning, and I moved it to the end of the slideshow. So if you printed them out, if you flip back towards the beginning, you'll probably notice a page that we skipped over. So this is accessory vessels. They empty into your superior vena cava, which means the fluid that's in these vessels mixes with your blood. And they also attach to lymph nodes, your lymph, the spleen, and the thymus gland. So just to situate some of these things, your thymus gland is sort of right in the middle of your chest near where your heart and your lungs are. Your thymus gland, if you look down here, all of those T cells, killer T cells, helper T cells, memory T cells, they come from the thymus, which starts with the letter T. So this is where those cells mature. Your spleen, so your spleen is sort of right here, near where your diaphragm is. You could live without your spleen. A splenectomy is a thing that could happen. Your spleen helps to clean your blood, just like your liver helps to clean your blood. So that's your spleen. And then your lymph nodes. Your lymph nodes, so just like the AV node in your heart was a collection of fibers, lymph nodes are where a bunch of lymph vessels collect in one place. So you have lymph nodes in your neck. You have lymph nodes in your armpits. You have lymph nodes down there in your groin. And then you have vessels all over the place attaching these things to each other. So something that the doctor will often check, and I know this from personal experience because my lymph nodes are continuously swollen because of my tonsillitis that I have, but the doctor will often check your cervical lymph nodes, the ones in your neck, and they're kind of right underneath your jaw. If you're not sick, you really can't feel them. If you want to feel what an inflamed lymph node feels like, you can feel mine. They're gross. But these lymph nodes help clean the lymph, help filter and remove things from the lymph that your body wants to get rid of. The superior vena cava is really the connection. This fluid goes into your superior vena cava. Your blood doesn't go into your lymph. Only your lymph goes into your blood. The thing that connects the two of them is white blood cells. White blood cells move back and forth between your lymph and between your blood.